Hello, this is Tom Bush. I'm a retired rheumatologist. I worked for many years at Santa Clara Valley Medical Center. And Lou Saavedra and Maggie Medueno from the Lupus Foundation of Northern California have asked me to answer a few common questions that lupus patients have about managing their disease. There we go. So, how to manage your lupus? What about vaccines? Which vaccines are safe for people with lupus? Well, there's two basic types of vaccines. There's inactivated vaccines, which are the safe type, and live vaccines, which I'll talk about on another question. The inactivated vaccines, in this case, there's a virus or a bacteria that can cause a bad infection. And the scientists have been able to take a little piece of a surface marker off of the virus or bacteria, and when they give that to you as an injection or maybe as a pill, the little particle causes a good immune response and gives you lifelong protection against that bacteria or virus. In this case, the vaccines are very safe because they're not really giving you something that might cause an infection. They're just giving you a piece of the cell lining of a bacteria or a virus, which is not going to cause any problems, but can induce a good immune response. Some common vaccines in this group include the injectable flu shots. The nasal spray you really shouldn't use. That's a live vaccine, but the injectable flu shots are very safe. The shots to pneumococcal pneumonia, a bacterial infection called a pneumovax, are also very safe, and we recommend them routinely for patients with lupus. In regards to the shingles vaccine, the newer shingles vaccine called Shingrix that came out about 3 or 4 years ago is an inactivated vaccine and is safe to take, and it is highly recommended for patients as they get older. If you need a tetanus shot, those are safe. They may come along with a diphtheria vaccine called a TD, or with a pertussis vaccine called a Tdap. There's a newer vaccine that has come out in the last 10 years against HPV. This is human papillomavirus. This is a viral infection. It's a genital infection that people may acquire in their youth or their early 20s. And in women, this has been shown to be a leading cause of cervical cancer. So this is an important vaccine, and it is safe. In addition, you may need a vaccination to hepatitis B. This is also safe.